This is the anatomical position of a frontal bone. The upper vertical squamous part is convex and directed forwards. The orbital part is horizontal and lies backwards. The nasal part is directed forwards and downwards. Frontal bone has four parts: vertical squamous part of frontal bone, zygomatic part, orbital part, and nasal part. It has two surfaces, or sometimes you can say three: external surface, internal surface, and temporal surface. And it has two borders. Lower border is the supraorbital margin, and another border is posterior border or the parietal border, which articulates with the parietal bone. Now we will talk about external surface. It has two frontal tuberosities. They are rounded elevation and it has some importance. Ossification of parietal bone starts at this point and they are more prominent in young female than male. And there are two superciliary arches and they are arched elevations below the frontal tuberosities, and they are more prominent in male than female because the male ear sinuses are large and they meet at this point. This is called clavella. This is a hairless point and it is supraorbital margin. It has its lateral part is lateral 2/3 is sharp and medial to 1/3 is blurred, and the junction has supraorbital foramen. You can see a foramen, supraorbital foramen, and more medially this lies supratrochlear notch. And the content of supraorbital foramen is supraorbital nerves and vessels, and the content of supratrochlear notch is supratrochlear nerves and vessels. They are both are branches of ophthalmic artery. And now we'll learn about interior surface. There are group for meningeal vessels. This is sagittal sulcus, frontal crest, and crista galli. And the foramen between frontal crest and crista galli, this is foramen cecum. And beside the crista galli, these are the cribriform plates. Now the content of sagittal sulcus. Sagittal sulcus content is superior sagittal sinus, which is a part of dural venous sinus, and there are two margins. Here there are two margins. They attaches the fox cerebri. What is fox cerebri? This is a sickle shaped dural fold, and this is frontal crest. Its attachment is anterior part of fox cerebri. And the foramen cecum. The foramen cecum connects veins of nasal mucosa to superior sagittal sinus, or we can say it's a communicating vein or emissary vein. Emissary vein is a connecting vein, and this is a crista galli. Crista galli. What is crista galli? Crista galli is a part of ethmoid bone. These are granular foveoles. They are pit-like structure beside the sagittal sulcus, and they are large arachnoid granulations. The cribriform plate transmits olfactory. This is the temporal surface. This is superior temporal line, inferior temporal line. Superior temporal line attaches temporalis fascia. Inferior temporal line attaches temporalis muscle. This is orbital part. It forms the orbital part of frontal bone forms the roof of orbital cavity, and anterolaterally there are lacrimal fossa, which has lacrimal glands. This is the nasal part. This is nasal spine. This is nasal notch, and there is a clinical condition. And when intracranial pressure rises, the emissary vein, which connects the intracranial veins with the nasal mucosal veins, the extra blood from intracranial veins drains into the nasal vein, and we got nasal bleeding, which is called epistaxis.